She's my baby girl. My name is Shawna Seale. I'm 48 and I live in Crum, Texas. All right, get mommy out of the way. Come on. We have a small ranch with cows, donkeys, horses. You're being a good boy. With ranch life, you have to be able to be physically mobile. You have to be able to lift, you have to be able to carry. It's a simple life, but it is not easy. I started noticing issues with my knees in my 20s. Pain, mobility was getting a little more difficult. There was one day that was the turning point. I knelt down at the store and something had happened, and that was the point that I knew I needed help.
When Shawna first came to me, she had significant knee pain. She was complaining that her knee was impacting her quality of life, her activities of daily living, and she was really suffering with her knee.
I was not surprised in the least when I finally got the diagnosis of osteoarthritis. With my family history, with my lifestyle, and just the activity that every day brought.
Shawna ended up having a knee replacement. We did it robotically, and what we did was remove the arthritic portions of her knee and replace that with a metal and plastic component. The robot not only helps me make a better surgery for the patient by allowing me to make more accurate cuts based on the patient's anatomy, but it also helps the patient because it's less invasive. It allows us to do the procedure with less steps, and then it enhances the patient's recovery.
Today, almost a year post-op, I'm extremely happy. There we go, such a good boy. I am completely back to full mobility and helping on the ranch. My personal experience with Medical City Louisville was incredible. I could tell that no matter what was going on, I was a priority and that I was going to be taken care of. Come on, sweet boy. I think it's just one of the best decisions that I've ever made.